When it comes to personal hygiene, many people take great care in choosing products that feel refreshing, smell pleasant, and promise cleanliness. But when it comes to intimate care, especially the area around the vagina, the choices you make can impact your comfort and health in unexpected ways. Have you ever tried a new soap or body wash and noticed itching, irritation, or even an odd odor? If so, you're not alone. The vagina and the surrounding vulva are sensitive, and their reactions to new soaps are more common than you might think. Understanding why this happens and what you can do about it can help you make choices that keep you comfortable, healthy, and confident. The first thing to know is that the vagina is a self-cleaning organ. It maintains its own balance of good bacteria, known as the vaginal microbiome, and carefully controlled acidity levels, often called pH. The vaginal environment is naturally acidic, with a pH between 3.8 and 4.5. This slightly acidic environment is crucial because it creates a barrier against harmful bacteria and infections. The bacteria that thrive here, especially lactobacilli, help keep things in balance. The outer area, the vulva, is not self-cleaning, but is also sensitive and easily disrupted by external products. When you introduce a new soap or body wash, especially one with strong fragrances, dyes, or harsh chemicals, you risk disrupting this delicate balance. Many soaps are alkaline, meaning they have a higher pH, which can neutralize the vagina's natural acidity. Others contain ingredients designed to remove oils, which can strip away the protective moisture from the vulva, leaving it dry and irritated. Even products labeled as natural or for sensitive skin may contain essential oils or botanical extracts that, while appealing in theory, can provoke allergic reactions or sensitivities. Reactions to new soaps can manifest in several ways. The most common symptoms include itching, redness, swelling, or a burning sensation. Sometimes you might notice an increased or altered discharge, a change in odor, or even the development of small bumps or rashes. These symptoms are your body's way of signaling that its protective barriers have been compromised and that an irritant has been introduced. But why do some people react more strongly than others? The answer lies in individual biology. Some people have more sensitive skin, a tendency toward allergies, or a naturally lower tolerance for certain chemicals. Hormonal fluctuations, such as those during menstruation, pregnancy, or menopause, can also make the vulva and vagina more sensitive. Furthermore, if you have a history of eczema, psoriasis, or other skin conditions, the vulvar skin may be even more reactive to new ingredients. It's also worth noting that the vagina's microbiome is unique, much like a fingerprint. What works for one person may not work for another. Even if a product is marketed as gynecologist-recommended or pH-balanced, it doesn't guarantee it will suit everyone. Sometimes reactions don't happen immediately, but develop over days or weeks as your body accumulates exposure to the offending substance. So, what should you do if you notice irritation after trying a new soap? The first step is to stop using the product immediately. Allow your body a few days to recover. In most cases, mild irritation will resolve on its own once the source is removed. Avoid scratching the area, as this can worsen irritation or introduce infection. If you need to soothe discomfort, a cool compress or a soak in plain, lukewarm water can help. Avoid using any other potentially irritating products, such as scented wipes, powders, or sprays, until the area has healed. If symptoms persist for more than a few days, become severe, or are accompanied by unusual discharge, a strong odor, or pain, it's important to consult a healthcare provider. These could be signs of a yeast infection, bacterial vaginosis, or another condition that may require medical treatment. Prevention, however, is always better than cure. When it comes to cleaning the vulva, less is more. Gently washing the external genitalia with warm water is often sufficient for most people. If you prefer to use a cleanser, choose one that is unscented, hypoallergenic, and free from dyes, parabens, and harsh detergents. Avoid washing inside the vagina itself. Douching is unnecessary and can disrupt the microbiome, increasing the risk of irritation and infection. Reading ingredient labels is a smart strategy. Look out for potential irritants such as sodium lauryl sulfate, artificial fragrances, and strong preservatives. Just because a product is organic or natural doesn't mean it's safe for intimate use. Essential oils, for instance, can be highly irritating to sensitive skin. Choose gentle, dermatologist-tested products and always do a patch test on a small area of skin before using a new soap or wash around your vulva. Another important tip is to be mindful of other products that come in contact with your vulva. This includes laundry detergents, fabric softeners, and even toilet paper. Fragrance products in these categories can also cause irritation. Opt for fragrance-free and hypoallergenic options whenever possible. Personal hygiene habits also play a role. Avoid overwashing or scrubbing the area vigorously, as this can strip away natural oils and cause micro-tears in the skin. Pat the area dry with a soft towel instead of rubbing. Wear breathable cotton underwear and avoid tight-fitting clothes that can trap moisture and heat, creating an environment that fosters irritation or infection. If you're someone who enjoys baths, be cautious with bath bombs, bubble baths, and bath salts, as these often contain fragrances and dyes that can linger on the skin and disrupt the delicate balance of the vulva and vagina. Showering with plain water or using a mild, unscented cleanser is safer for intimate areas. It's also helpful to remember that the vagina's odor can fluctuate naturally. A slight, musky scent is normal and healthy. Trying to mask it with perfumed products often does more harm than good. If you notice a strong, fishy, or foul odor accompanied by other symptoms, it's a signal to seek medical advice, not to use stronger soaps. For those who menstruate, menstrual hygiene products can also contribute to irritation. Pads and tampons with added fragrances or harsh materials can irritate the sensitive vulvar skin. Consider switching to fragrance-free, organic cotton products or menstrual cups made from medical-grade silicone, which are less likely to cause irritation. Sexual activity can also play a role. Lubricants, condoms, and other products used during sex can contain ingredients that may irritate sensitive skin. Opt for water-based, fragrance-free lubricants, and if you or your partner react to latex condoms, try latex-free alternatives. If you have had repeated reactions, or if you have a history of sensitive skin, it may be worthwhile to consult a healthcare provider for personalized recommendations. They can help identify specific allergens or triggers and suggest safe products for daily use. In summary, the reason your vagina and vulva react to new soaps is rooted in the area's unique biology and sensitivity. The balance of pH, the presence of protective bacteria, and the thin, delicate nature of the skin all make this area highly reactive to changes. By choosing gentle, unscented products, paying attention to personal hygiene habits, and prioritizing comfort over fragrance, you can help maintain a healthy, comfortable, intimate area. Remember, the goal of intimate hygiene isn't to achieve a perfumed freshness, but to support your body's natural defenses and keep you healthy. If in doubt, consult a healthcare provider. Your body's signals are worth listening to, and taking care of your intimate health is an important part of overall well-being. Trust your instincts, treat your body kindly, and know that taking a gentle, minimalist approach is often the best way to care for one of the most sensitive parts of your body.